I was diagnosed with osteosarcoma bone cancer.
They told me I had a tumor in my knee.
Acute lymphoblastic lymphoma.
My tumor was so big, I had to remove my whole left pelvic bone.
I was diagnosed with a brain tumor and anaplastic astrocytoma.
Cincinnati Children's is known for treating kids, but there's another group that comes here for cancer treatment. They're known as the AYAs, short for Adolescent and Young Adults. They choose to come here instead of adult cancer centers because we offer what many adult centers don't. We couple comprehensive treatment with clinical trials, cutting-edge fertility preservation services, and support for the entire family.
Well, I think we have a holistic approach. It's basically the best of both worlds. You get the input of pediatric oncology because most young adults have cancers that are actually much more common in children than in elderly adults, but you also have excellent adult medical care here at the facility.
Here, patients have access to the most advanced treatments.
We can offer therapies that are optimizing the standard of care, or if in a patient who has a very aggressive cancer, offer cutting-edge therapies that may not otherwise be available.
Our staff of pediatric experts is used to extending a little hand-holding, even to teens and adults.
The family-centered care that we deliver here is an emphasis that you don't see in the adult facilities. So when the patients come here, we consider not only how it affects the patient, but how it may affect their very important significant other, their fiancé, their parents, maybe their other siblings.
Our cancer specialists have helped change the outcome for thousands of patients. We want to help you kick cancer too.
Our goal is to cure these patients and to do it in a way where they are allowed to go back to their lives, hopefully as normal as possible.
We know the best medicine comes in many forms. Maybe it's laughter in the teen lounge or music at your bedside.
It's incredible to walk this journey with our patients and families, and I think we all feel really privileged to be able to do that.
Sometimes you may just need someone to listen.
You're trying to gain your independence and your autonomy, and then you get, a significant diagnosis, and you can sometimes feel like life has to be put on pause. And so I think it's important to recognize that and to work through that and have someone who understands and can help with interventions.
Them kind of holding my hand to go through this unknown, whatever was about to happen, having them there and having just met them, the day before, made me feel really okay.
I never really looked forward to taking chemo, but whenever I got there, I was just always comfortable. Just the family atmosphere just felt great.
So from the first day that I was here, I always felt like that there was a light at the end of the tunnel, which is so important. Because if you don't have that, then it's going to be hard to get out of bed during the day.
It's a little different because it is a children's hospital and I have a child myself, but I don't really feel any different because they don't treat me like I'm a child. They treat me as if I was an adult.
They never stopped me from wanting to do what I wanted to do. They were always so encouraging. And maybe that's why God sent me to Children's Hospital, because I think an adult hospital, they would have treated it a lot different.
At Cincinnati Children's, we can turn a frightening diagnosis into a game plan for beating it. Learn more at cincinnatichildrens.org/AYA.